Have you ever wondered if there's a safe way to make your penis bigger, or why sometimes your urine stream seems to go in all directions? Welcome back to the Reena Malik MD podcast. I'm Dr. Reena Malik, urologist and pelvic surgeon, and in today's Ask Me Anything series, I'll be answering some of your most common and most relatable questions about men's sexual and urologic health. Let's begin with a question I get often from younger men. I'm 24 and I find myself overthinking during sex. I get anxious about whether I'll stay hard, and that stress sometimes causes me to lose my erection. I've had this happen with 2 partners, and I don't want it to keep happening. What's going on? First, I want to say that this experience is incredibly common. Nearly every man will have difficulty maintaining an erection at some point in his life. Erections are not static. They fluctuate based on many factors: stress, fatigue, alcohol, medications, even temperature. But what often happens is that when a man loses an erection once, it triggers a cycle of anxiety. The next time he's intimate, he's so worried about staying hard that the stress response itself interferes with the body's ability to perform. It becomes a loop. Anxiety leads to loss of erection, which leads to more anxiety. This is what we call psychogenic erectile dysfunction, meaning the cause is primarily psychological rather than physical. It's particularly common among younger men. However, I always remind my patients that even at 24, it's important not to dismiss the possibility of an underlying medical issue. Studies show that up to 87% of men under 40 with erectile dysfunction actually have a physical contributor, whether that's high blood pressure, elevated cholesterol, diabetes, or other vascular conditions. The arteries that supply blood to the penis are small and sensitive. They often show signs of disease earlier than larger vessels that feed the heart. In that sense, erectile issues can serve as an early warning sign of cardiovascular problems. So the first step is always to check in with your primary care doctor or urologist for a simple evaluation. Assuming no physical cause is found, we can focus on managing the psychological aspect. One of the most effective strategies is working with a sex therapist or psychologist who specializes in sexual performance anxiety. Therapy helps men unpack the fear of failure and retrain their focus toward pleasure and connection rather than performance. Another helpful approach is to take penetrative sex off the table temporarily. Instead, couples can explore each other's bodies through touch, kissing, and non-genital stimulation. The goal is to rebuild comfort and pleasure without pressure. Once you're able to stay relaxed and present during those moments, you can gradually reintroduce genital contact and eventually penetration. This step-by-step process helps retrain the brain to associate intimacy with relaxation rather than anxiety. For some men, medications like sildenafil Viagra, tadalafil Cialis, or vardenafil Levitra can be useful tools. These medications don't create erections on their own. They simply make it easier for the body to maintain one in response to arousal. In many cases, short-term use can help rebuild confidence while addressing the underlying anxiety. What's important to understand is that erectile dysfunction, especially in young, healthy men, is rarely a permanent condition. It's often reversible with the right combination of reassurance, communication, and sometimes therapy or medication. Most importantly, it's not a reflection of masculinity or worth. Erections are a complex balance of blood flow, hormones, and nerves, all regulated by the brain. And when the brain feels stressed or threatened, it prioritizes survival over arousal. So losing an erection during anxiety is actually a completely natural physiological response. Now, let's move on to another question that comes up frequently, one that reflects a lot of myths and misconceptions about male anatomy. Are adult film actors naturally well endowed, or do they use some kind of enhancement? And if so, what kinds of techniques or treatments are available for men who want to increase size? It's an understandable curiosity. The adult entertainment industry often portrays exaggerated images of male anatomy that are far from the average reality. In truth, most performers are selected for their physical characteristics, including larger than average genitalia. The average erect penis length worldwide is about 5'4" inches, with 99.7% of men falling under 7.2 inches. That means what we see in adult films represents a very small fraction of the population, and often the camera adds even more distortion through angles, lighting, and perspective tricks. While there are indeed procedures and devices designed to enhance size or girth, their safety and effectiveness vary widely. Non-surgical options include traction devices, which apply gentle tension to the penis over time and may increase length by a small margin, usually around 0.5 inch to 1 inch after several months of consistent use. Another popular option is dermal filler injections for girth enhancement. These can make the penis appear thicker, but come with risks such as unevenness, nodules, or infection if performed by unqualified providers. Some adult performers also use pharmacological aids to maintain erections for long shoots. This can include oral medications like sildenafil or tadalafil, or in some cases, intracavernosal injections, medications injected directly into the penile tissue that produce rapid, long-lasting erections. A few may even have penile implants, which are devices surgically placed inside the penis to allow on-demand rigidity. These are typically used to treat severe erectile dysfunction, not to enhance performance in healthy men. It's important to remember that pornography is entertainment, not education. It's designed to be visually stimulating, not realistic. Using porn as a reference point for what's normal can create unhealthy expectations for both men and women. Real sex involves communication, connection, and imperfection. It's not scripted, choreographed, or edited. Comparing yourself to what you see on screen only fuels self-doubt and anxiety. Finally, another question that comes up a lot, and one that's much more common than most men realize, is about urination. Sometimes when I pee really hard, the stream splits into two or sprays in different directions. What's happening? A split or deviated urinary stream can have several explanations, and most are benign. Think of your urethra, the tube that carries urine from the bladder, as a hose. If there's any obstruction or narrowing in the flow, the stream can divide or spray unpredictably. One common cause is residual semen or discharge left in the urethra after ejaculation, which can temporarily block part of the opening and cause the stream to split. This usually resolves on its own after the next few urinations. However, if the problem persists, it could indicate something more structural, such as an enlarged prostate or a urethral stricture, a narrowing of the urethra caused by scarring or inflammation. Men with these conditions may also notice a weak flow, hesitancy when starting to urinate, or the need to strain. If you experience any of these symptoms, it's important to see a urologist for an evaluation. These conditions are very treatable, and early intervention can prevent complications like urinary retention or bladder damage. In the meantime, one simple adjustment some men find helpful, especially when dealing with splashing or spraying, is to urinate while sitting down. Though this isn't common practice in the US, it's entirely normal in many countries, including Germany, and can make the experience more comfortable and controlled. These questions may seem very different: erectile dysfunction, penile enhancement, and split urinary stream, but they all touch on the same theme: the importance of understanding how your body works and recognizing what's normal. In the next chapter, we'll dive deeper into the science behind these conditions, why they happen, what they mean for your health, and what you can do to treat them effectively and safely. When it comes to men's sexual and urologic health, understanding the why behind what happens in your body can be one of the most empowering things you can do. So many of the issues men face, from performance anxiety to changes in urinary stream, stem not only from physical factors, but also from a lack of clear science-based information. In this chapter, let's take a closer look at the underlying mechanisms that drive these common concerns and what modern medicine and lifestyle choices can do to help. Let's start with erectile dysfunction, ED, which can be broken down into two broad categories: organic, caused by physical issues, and psychogenic, caused by psychological factors. For younger men, as we discussed earlier, psychogenic ED is often the main culprit. But even then, physical factors sometimes play a role. Erections depend on a complex interplay between blood flow, nerve signals, hormones, and psychological stimulation. When any one of these components is disrupted, the result can be difficulty achieving or maintaining an erection. The process begins with arousal. When the brain perceives sexual stimuli, either physical or psychological, it sends signals down the spinal cord and into the pelvic nerves, releasing nitric oxide in the penile tissue. Nitric oxide triggers relaxation of the smooth muscles in the penis, allowing blood to flow into two chambers called the corpora cavernosa. As these chambers fill with blood, the veins that normally drain the penis get compressed, trapping the blood inside and creating an erection. If this process is interrupted, say, by stress or anxiety, the brain sends competing fight or flight signals that cause the blood vessels to constrict. The body cannot focus on arousal and survival at the same time. This is why performance anxiety can be so disruptive. It activates the very system designed to inhibit erections. On the physical side, anything that interferes with blood flow can contribute to erectile issues. High blood pressure, diabetes, high cholesterol, and smoking all damage the inner lining of blood vessels, reducing their ability to dilate properly. Low testosterone can also play a role, though less commonly than many people assume. Testosterone contributes to libido and energy, and when levels are chronically low, it can blunt sexual interest and responsiveness. For this reason, any man struggling with persistent ED should have his hormones checked as part of a full evaluation. Thankfully, ED is one of the most treatable conditions in urology. The first line of treatment is usually oral medications, phosphodiesterase type 5 inhibitors such as sildenafil Viagra, tadalafil Cialis, and vardenafil S. These medications work by enhancing the effects of nitric oxide, allowing better blood flow to the penis. They are safe for most men and have revolutionized the management of ED since the late 1990s. For men who don't respond to pills, there are other excellent options, including vacuum erection devices, intracavernosal injections, and even penile implants, which can restore function with a very high satisfaction rate. But while medications can address the symptoms, I always emphasize the importance of addressing the root cause. For psychogenic ED, cognitive behavioral therapy, CBT, mindfulness, and sex therapy can be transformative. Simple techniques like breathing exercises, guided relaxation, and focusing on non-penetrative intimacy can help break the anxiety cycle. Regular exercise, adequate sleep, and limiting alcohol are also crucial since vascular health, mental health, and sexual function are deeply interconnected. Now, shifting gears slightly, let's talk about penile enhancement, a topic that generates endless curiosity and confusion. While it's perfectly normal for men to wonder about their size, it's important to separate myth from medical fact. Most men who believe they have a small penis actually fall within the normal range. Research published in BJU International found that the average erect penis measures around 13.4 cm at 5.2 inches in length and 11.6 cm at 4.6 inches in girth. Only about 2.5% of men have a penis smaller than 9.3 cm at 3.7 inches when erect, a condition called micropenis, which is usually linked to hormonal or developmental factors. There are indeed ways to modify penile appearance, but none come without trade-offs. Non-surgical approaches such as traction therapy can provide modest improvements in length, typically about 0.5 to 1 inch, by stretching the penile tissue over several months. It requires consistency and patience, often involving several hours of daily wear. Penile fillers, typically made from hyaluronic acid or other biocompatible substances, can temporarily increase girth. While results can be impressive, these injections need to be performed by experienced, board-certified urologists or plastic surgeons. Otherwise, they can lead to uneven texture, pain, or scarring. Surgical options do exist, but they are far more invasive and carry significant risks. Procedures like suspensory ligament release, which cuts the ligament attaching the penis to the pubic bone, may give the illusion of added length when flaccid but not when erect. Fat grafting or dermal fat transfer can increase girth, but results often diminish over time. Moreover, surgery can lead to complications like infection, loss of sensation, or erectile dysfunction. That's why I tell my patients proceed with extreme caution. If you're considering enhancement, do it for yourself, not because of what you've seen online, and always consult a qualified urologist who specializes in men's health. It's also worth noting that some men in the adult industry rely on medications or injections to sustain erections for long filming periods. Intracavernosal injections, for example, use drugs like alprostadil or papaverin to induce a reliable erection within minutes. Some may even have penile prostheses, devices implanted inside the penis that allow for manual inflation. These are legitimate medical treatments for severe ED, not cosmetic enhancements, but their use in the adult industry has helped create unrealistic expectations about what's normal or sustainable. Now, let's revisit something seemingly less glamorous but equally important: urination patterns. Many men are surprised to learn that changes in urine stream, whether it's split, spraying, or weak, can provide valuable clues about urinary tract or prostate health. A healthy urinary stream should be steady and straight. When the flow splits, sprays, or deviates, it usually indicates a mechanical issue somewhere along the urethra, the tube that carries urine out of the body. One of the most common culprits is benign prostatic hyperplasia, BPH, or prostate enlargement, which affects nearly 50% of men by age 50 and up to 90% by age 80. The prostate sits just below the bladder and surrounds the urethra like a ring. As it grows with age, it can squeeze the urethra, making it harder for urine to flow freely. Symptoms may include a weak stream, hesitation, dribbling, or the feeling of incomplete emptying. Another potential cause is a urethral stricture, which is a narrowing of the urethra due to scar tissue, trauma, or infection. Strictures can lead to split or spraying urine, discomfort, and sometimes urinary retention. Diagnosis typically involves a simple uroflow test, to measure flow strength, and imaging studies like retrograde urethrogram. Treatment can range from dilation, widening the narrowing, to surgical repair. In younger men, a split stream often occurs because of temporary obstruction from residual semen or mucus after ejaculation. In such cases, the symptom resolves on its own. Still, if the problem is persistent, especially if accompanied by pain, difficulty starting the stream, or blood in the urine, it's worth seeking an evaluation. Another subtle but interesting factor is urinary posture. In many parts of the world, particularly in Europe, it's common for men to sit while urinating. This position can help relax the pelvic floor muscles, reduce residual urine, and improve flow for men with mild obstruction. In one study published in PLOS O&E, researchers found that men with lower urinary tract symptoms experienced better bladder emptying and fewer post-void drips when they urinated sitting down compared to standing. It may not be the cultural norm in some countries, but medically it's a perfectly healthy option. All of these conditions, ED, penile size concerns, urinary changes, intersect around one key idea: men's health is both physical and psychological. Anxiety, shame, and misinformation often prevent men from seeking help early. Yet, almost every one of these issues has effective treatments. Understanding the physiology not only empowers you to take control of your health, but also helps normalize the conversation around these very human experiences. In the next and final chapter, we'll shift our focus toward what you can do proactively: simple, evidence-based lifestyle changes and mindset shifts that support optimal sexual and urinary health. Whether it's diet, exercise, stress management, or relationship communication, I'll share the practical tools every man should know to maintain confidence, function, and overall well-being. Lasting improvement in sexual and urologic health rarely comes from a single pill or quick fix. Instead, it's built through consistent, evidence-based habits that support your body's natural physiology. In this final chapter, we'll shift from understanding the why to empowering you with the how. Whether you're trying to last longer in bed, improve your erections, or maintain a strong urinary stream as you age, these science-backed strategies can make a profound difference. Let's start with the foundation of all good health: blood flow. Erections, ejaculation, and even prostate function depend on a robust vascular system. Anything that affects your arteries, such as high cholesterol, hypertension, or diabetes, also affects your penis. In fact, erectile dysfunction can be an early warning sign of cardiovascular disease, sometimes appearing years before a heart attack or stroke. That's why one of the most effective ways to boost performance is to protect your heart. 1. Nourish your blood vessels with the right diet. Research consistently shows that diets rich in plant-based foods, healthy fats, and antioxidants support better sexual health. The Mediterranean diet in particular has been linked to improved erectile function. It emphasizes fruits, vegetables, whole grains, legumes, nuts, fish, and olive oil, foods that reduce inflammation and enhance blood vessel elasticity. Certain nutrients deserve special mention. L-citrulline and L-arginine, found in watermelon, nuts, and seeds, help increase nitric oxide production, the same pathway used by ED medications. Omega-3 fatty acids from salmon, sardines, and flaxseed improve circulation and reduce arterial stiffness. Dark leafy greens and beetroot naturally boost nitrate levels, supporting blood vessel dilation. On the other hand, minimize processed meats, refined sugar, and trans fats, which impair blood vessel function and lower testosterone. Small, consistent dietary changes often produce remarkable results within a few months, not only in sexual performance, but also in energy and mental clarity. 2. Exercise for better performance and hormonal balance. Regular exercise does more for sexual health than almost anything else. Physical activity enhances blood flow, improves stamina, boosts mood, and regulates hormones. Even a 20-30-minute brisk walk 5 times per week has been shown to improve erectile quality. Strength training adds another layer of benefit. Lifting weights or engaging in resistance exercises helps increase testosterone, the hormone central to libido, muscle mass, and mood stability. Studies show that men who train regularly often have higher baseline testosterone levels compared to sedentary men of the same age. Don't overlook pelvic floor exercises, Kegels. Just as these strengthen muscles in women, they also benefit men by improving control over ejaculation and urine flow. To identify your pelvic floor muscles, try stopping your urine midstream. The muscles you use to do that are the ones you'll train. Contract them for 5 seconds, relax for 5 seconds, and repeat 10-15 times, 2 to 3 times per day. Over time, these exercises can improve both endurance and bed and bladder control. 3. Sleep, stress, and the mind-body connection. Sleep deprivation is one of the most overlooked causes of low libido, premature ejaculation, and erectile dysfunction. During deep sleep, the body releases testosterone and growth hormone, both of which are vital for recovery and sexual vitality. Aim for 78 hours of high-quality sleep per night. Stress, on the other hand, can sabotage even the healthiest body. Chronic stress elevates cortisol, which suppresses testosterone and interferes with the brain's ability to maintain arousal. Performance anxiety in particular creates a vicious cycle. Worrying about lasting longer or performing well triggers the sympathetic nervous system, how your fight or flight responsive, which physiologically inhibits erections. Breaking that cycle requires shifting focus from performance to pleasure and connection. Techniques such as mindful breathing, body scanning, or sensate focus, a structured intimacy exercise, help reduce anxiety and reframe sex as an experience rather than a test. These tools are simple yet powerful. When you calm the mind, the body follows. For communication, the hidden key to satisfaction. Many couples underestimate how transformative honest communication can be for sexual fulfillment. Studies show that couples who openly discuss their preferences, desires, and concerns report higher satisfaction and lower rates of sexual dysfunction. If premature ejaculation or erectile difficulties are affecting your relationship, bring your partner into the conversation. Expressing vulnerability often deepens trust and makes it easier to explore solutions together, whether that's adjusting pace, experimenting with different forms of intimacy, or trying medical treatments. A practical strategy I recommend to couples is the stop-start technique. During intercourse or foreplay, when you sense ejaculation approaching, stop stimulation entirely until the urge passes, then resume. Over time, this retrains your body's response and improves control. Combining this with communication and patience turns a medical challenge into a shared learning process. 5. Prostate health and aging gracefully as men age. Prostate enlargement and urinary symptoms often become part of the conversation, but proactive lifestyle choices can slow this process. Maintaining a healthy weight, limiting red meat, and consuming foods rich in lycopene found in tomatoes, zinc in pumpkin seeds and oysters, and green tea catechins have all been shown to support prostate function. Staying hydrated is also important, though timing matters. Try reducing fluid intake a few hours before bed to minimize nighttime urination nocturia. Avoid excessive caffeine and alcohol, which irritate the bladder and can worsen urinary frequency. If you ever notice blood in your urine, pain with urination, or persistent changes in flow, it's crucial to see a urologist. These symptoms could signal infections, stones, or early prostate issues, all highly treatable if detected early. 6. Medical support and modern treatments. While lifestyle is the cornerstone, it's perfectly appropriate to seek medical help when needed. Premature ejaculation, erectile dysfunction, and urinary issues are medical conditions, just like asthma or hypertension. Treatments range from prescription medications and topical creams to innovative options like low-intensity shockwave therapy for erectile function and behavioral coaching for sexual performance. Working with a board-certified urologist ensures your treatment plan is safe, evidence-based, and tailored to your unique physiology. And remember, seeking help is not a sign of weakness. It's a sign of awareness and commitment to your health and your partner. 7. Redefining masculinity and sexual confidence. Ultimately, lasting longer, performing better, and feeling more confident in your body are not about comparison. They're about connection, self-awareness, and care. Real sexual confidence comes from understanding your body, accepting your limits, and embracing intimacy as a shared experience rather than a solo performance. When you combine knowledge, lifestyle balance, and open communication, the results often exceed expectations, not just physically, but emotionally, because the true measure of sexual health isn't how long you last, it's how fulfilled, connected, and confident you feel with yourself and your partner.